Welcome! If you're watching this video, that probably means that you have some interest in considering opening your own private therapy practice as a professional social worker one day. And I often get questions from students about the pros and cons and what's involved, how you do it, and I just wanted to provide some of my own insights from my experience doing so. So today I'm going to talk to you a little bit about how to get started, what the typical schedule looks like, finances, which is a big element of it, some ethical considerations, and then how to practice community and self-care to sustain yourself while working in private practice. I do want to just give a disclaimer that this is completely just my own personal experiences. I have only been doing private practice part-time, and it's only been 4 or 5 years, I suppose. So certainly my experience is not comprehensive and representative of everybody's, and I highly encourage you to talk to other therapists to see what their perspectives and experiences are. And this is not any kind of legal advice. This is me just kind of describing what I went through and some of the different decisions and tips from me. So the big picture of opening your own private practice is essentially, the great thing is that you can be your own boss. That means, you make your own schedule, you have a lot of autonomy and choice and flexibility in terms of what you practice, how you practice, when you practice. And there's also potential sometimes for higher earnings, particularly if you do private pay, if you put in a lot of hours. Again, it very much varies, right, between private practices and between private employed jobs. But overall, there tends to be more potential for higher earnings in private practice once you have a robust enough practice with time. The main cons are that it can be isolating. You're working by yourself, and so you don't have the same kind of supervision and colleague camaraderie that you might have working in an agency. And there's also a lot of responsibility in terms of making money, legal considerations, building your business. So it's certainly a lot more that you have to take on your shoulders, that those things might be handled otherwise if you're working at an agency or organization. So when you're thinking about getting your practice started, I would first consider what specializations you want to focus on. Many people have a fairly generic practice where they see a lot of different populations and concern issues, particularly early in their private practice careers, but you might want to focus specifically on a certain target population, like maybe children or older adults or veterans. And you also, in addition to or instead, might want to focus on a certain presenting problem, like eating disorders or trauma. And again, it kind of depends on a lot of things, your passions, certainly, but also the geographic area where you're practicing. If you're in a small town, you might have to be a little bit more general. And if you're in New York City, you might be able to have much more of a niche. I would also consider not only your passions, but your own personal experiences. A lot of times social workers come to the mental health field because maybe you've had a concern of your own, or you've had a personal experience with a loved one with a mental health issue. And I would just encourage you to really think through, where you have experience and calling, but also where you're whole and healed enough to be able to work in that area without feeling triggered too much, and making sure that you're working through any of your own things if it hits too close to home. So those are just some things to think about in terms of what your focus area is going to be and how you'll market yourself, what types of clients you'll be seeking. You also then need to make sure that you're trained and licensed to do that. This video is specific for social workers in private practice. Certainly there are psychiatrists, psychologists, LPCs, LMFTs, and many other mental health certifications and educational backgrounds that can do private practice. But as a social work professor, I'm focusing on social work. So in Texas, at the master's level, you have your LMSW, and then you have years of getting hours and clinical supervision to become an LCSW. How to become a clinical social worker is a video for another day. That is totally beyond the scope of this, this presentation. But in a nutshell, you can do some therapeutic work as a master's level social worker, an LMSW, under supervision from a clinical social work supervisor. And then at the point where you'd be opening your own practice, you would most likely have your LCSW. That's going to allow you more options for billing. Like, for example, an LCSW can bill Medicare. And so typically people, will have their LCSW when they're doing their practice, and probably some experience beyond the first time they got their LCSW as well. Many might have doctoral degrees too. Typically in social work, if you pursue a PhD, that's mainly going to lead to careers in academia or research. But the DSW, the Doctor of Social Work, is becoming much more common, and increasingly there are clinical focused DSW degrees that people use to elevate their practice further. And then there's also training and certification in particular modalities. For example, EMDR, if people are doing trauma work, it's important to go through official courses and get certified and training. The NASW Code of Ethics even lays out, what you should be doing in order to practice a modality, which is basically research and learning about it, getting practice and supervision in it before you try a new method. And so depending on what approach or approaches you use, you may or may not want to pursue official certification in that, that technique. But there are some techniques that you don't have to have a degree in necessarily to be able to use those tools, like mindfulness, for example. You could be trained as a mindfulness-based stress reduction. That's like a program at the University of Massachusetts. You could be trained to be a trainer in that technique, but you also can just tell people about the benefits of meditating or how to do a body scan without having a license on your wall to do that. So just really, I would say, bottom line, make sure you look into what types of approaches you want to use in your practice and find out what the legal and ethical requirements are for becoming trained and competent in those methods prior to practicing them with clients. So I kind of already jumped the gun here in terms of therapeutic approach in terms of the training, but just thinking also, in addition to that, learning and certification element, just what's evidence-based, doing your research and making sure that the techniques that you're using are current, up to date, and appropriate for the population and presenting issues that you are focusing on in your practice. Then it's time to set up your business. So again, certainly this is not legal advice. I would highly encourage you to potentially talk with an attorney or an accountant or both about, depending on what your practice is going to look like and what the pros and cons are of different business setups. But I would personally encourage looking into some kind of business entity. Personally, I did an LLC, a limited liability corporation, and essentially in very, very basic terms, if I, Karen Magruder, am just working and doing business and collecting money, but I don't have any business set up, it's all under me, the person. So I happen to get in some kind of legal trouble. I get sued, and there's some big lawsuit that comes out. If it's just me, the person, doing it, legally, they can come after everything. So all of my personal, money. I'm married, so anything that is jointly owned between my husband and I, our joint house, our, joint, retirement accounts, all of that is basically on the line financially if someone were to come after me. If I have an LLC, that basically protects my assets and says that the only, assets that are essentially up for grabs should there be a lawsuit is my business assets. So my limited, revenue that I have from the business, and not all of my own, my car and all of that kind of stuff that is personal property. I'm not going to go really into it, but there's also tax benefits to various things. There's also things to consider about whether it's your own thing, just you, or maybe you have a small group or a partnership, what you want to do. So essentially, there's many different ones. The ones that I've heard of being the most common are an LLC, a PLLC, which is a personal limited liability corporation, and an S Corp. Actually, I know someone now who's an accountant who I met after I did my LLC, who said that she would have recommended I do an S Corp actually for tax reasons. So there's pros and cons. Again, that's really outside of the scope. I don't have the legal expertise to advise you in your situations about what that is, but there are steps to take. So for example, with an LLC, I had to file some paperwork with the state of Texas. I had to get what's called a registered agent. And there's a few other steps that go into that. So there's lots of resources out there about how to do those depending on what type of business you set up. But it's a good idea to do that for tax and legal reasons. And I'll talk about this a little bit later, but it also means that you can write off a lot more of your expenses, which is helpful for tax reasons as well. So I'm now going to move to marketing. The nice thing about working at an agency or for someone else is usually they do a lot of that marketing, especially if it's like a bigger company. But if you've got your own thing, then it's up to you to drum up your own business. And that can be intimidating for a lot of people. In fact, that was one of my biggest reservations, because I had done fundraising, which is like sales with a soul, I like to call it. And I didn't enjoy it. I didn't like having to pound the pavement and ask people for money and promote and market. And I was unsure if I would, be satisfied doing that long term. But I actually got some reassurances from other therapists I knew who said it's actually not that bad. You don't have to do too much, networking. A lot of leads come in through referral or website therapist listings and things like that. So it kind of depends. I know some people that are really out there, and some people that don't invest as heavily in their marketing, but it's something that you want to be thinking about. The easiest, fastest way to get your name out there is to list yourself on therapist listings. There are many that require you to pay. So for example, psychologytoday.com has one of the most comprehensive listings, and you pay to be on that. Many would say it's worth it, because even if you get one client, it kind of pays for itself. There's also some free ones. For example, I am really the only way that I list myself online is something called OpenPath Collective. It is exclusively for people with a low income background, and basically the mission is to make therapy more affordable to people who might not otherwise be able to access it because of lacking health insurance or not being able to afford private pay, which can be very expensive. So for me, my therapy practice is kind of a service as well. And so I'm not doing it to get rich. I'm doing it to make a difference. And so I exclusively work with low-income clients on OpenPath. And so it's free for me, which is good, and to have me listed there, and that they can find me that way. And I can toggle it to see if I am or am not accepting new clients and different things like that. If you have a certain niche area, there might be a certain listing of, say, therapists who do motivational interviewing or whatever the technique or problem issue is that you're working with. There might be groups or listings that you can look into there. And then networking is really important. So going to continuing education, joining a networking group like a Chamber of Commerce, going to different, professional conferences and things like that to be able to meet people and share the word. You might also, I've heard people doing like blogs or YouTube videos to try to help get their name out there as an expert in a certain field or something like that. And then like looking at LinkedIn, obviously considering how you present yourself on social media. People, might be able to find your public profiles. And so if you're representing a business, even more so than when you're working as a social worker, you want to be mindful of those things. So just kind of thinking about your marketing strategy and plan. And then thinking about your office design. Some things to consider are having it be a warm, inclusive, inviting trauma-informed space. So something that is going to help put clients at ease, but also be professional, that's true to your personality, but not too personal. So I'm going to actually walk you through, I now, and I'll talk about this in a moment, do all of my therapy exclusively through telehealth, which started with COVID and is now continuing indefinitely. So this is actually a picture of my home office. And I'll kind of walk you through some of the elements of some things I was thinking about, and then some things that you would want to consider if this was a place where you're actually seeing clients as well. So I have up on the wall a few awards, licenses, and credentials. This is my social work license. I have 3 of my diplomas, and some things like that. And actually, you can't even see it over here, but I have some like mementos that of like things that students have given me. Like one was this really nice like message about being a mentor, and another one is like about what social work is. You can see it over my shoulder actually on the other side of that bookshelf. And that so you have to have your license posted. It's a good idea to have your diploma posted as well to kind of show that you have those credentials. I'm actually considering changing this a little bit because I also don't like, I want it to seem, this is a professional space and I'm licensed and credentialed to do this. But in thinking about maintaining that sense of like equality and collaboration and kind of decolonizing my practice, I don't know if it seems a little too like hoity-toity to have all these like awards and things behind me. So I'm actually thinking about potentially shifting it a bit. But then I have my books, again, not really to like look smart. It's really just to have on reference, because I can't tell you how many times I get up during a session and say, you should reference this book, or let's like, look, they ask me the question is, well, here's the DSM, here's what it says, about this condition, or things like that. Just easy to have on hand. I have a couple like personal things, a personal picture, but it's small enough and it's behind me in the chair when I sit here, people can't see it. And I have a chair. I try and keep my office. I have the luxury now. It was not always like this, but as of very recently, we bought a new home where I have my own dedicated office space, which is so fantastic because I can really help separate work from home. I actually literally have my Karen Magruder like name placard on the door that I like close when I'm done working for the day to maintain that separation. And that's a really helpful boundary thing for me because I used to work in a common area and it was a lot harder to maintain that separation mentally. So I do that. And I have this little kind of lazy boy chair as well, because I spend most of my time at my desk, but if I don't have to be on video and I'm just working on stuff and I want to chill a little bit, I have a little bit more of a relaxing space that's still in my workspace. That I'm not invading, my bed or anything like that with my work. And then here's the view that you don't see, which is my table. I try and keep it really neat and tidy. I often will have little like post-it notes or things with like affirming messages or goals or just things to remind myself of, mentors or things that I'm striving towards. But I try and keep it pretty tidy. I have my files and this nice big picture of Telluride. It's a nice big mountain picture that I can like look at and just look up and kind of center myself. I have my dog bed here. My dogs are with me when I'm working for school, not for therapy. I keep them outside. And I'll talk about that too when I talk about telehealth. But just setting up a space, I have images of tranquil scenes and things like that. It doesn't have to be fancy. I don't have like a fancy monitor. It probably would be good for my neck if I did that. But I mean, I literally just have my laptop sitting up on a shoebox to help it be like at eye level. So you don't need to have a big budget, but just something that feels affirming to you and to clients, that is kind of a safe space for everybody and set up in a way that is affirming and inclusive. So there's a whole lot of stuff out there about trauma-informed design. It's kind of outside of the scope of this lecture to really go through it in detail, but thinking about things like having choice in where people sit, safety for yourself, having, a safe exit should things escalate with a client, and different things like that. For me now, since I'm doing telehealth, some considerations to think about are HIPAA, and so making sure that you have a secure connection. You can't just do like a Google chat or FaceTime with a client. I use a secure platform called DoxyMe. It's actually free, but there's lots of secure platforms for telehealth that you can use that are paid services as well. And many of them actually bundle into other services. So for example, I think Simple Practice, I want to say, might have a telehealth option now. Don't quote me on that. But there's companies like that that provide kind of a suite of services where maybe there's like accounting and revenue logging type stuff, kind of like QuickBooks, or maybe they have something like a calendar where people can book appointments online, and they have video or file sharing or electronic records, that kind of thing. So you can get like a suite of those things, but I unbundle it. So I have DoxyMe as my secure video conferencing. And because my practice is very part-time and kind of informal, I actually just do booking myself. Like people call me or email me to book an appointment, or with my regular clients, it's just at the end of a session, okay, 2 weeks again, same time, same day, great, and book it and just put it in my own personal calendar. But if I had a more robust and more complex schedule, I probably would want to use some kind of a scheduling tool to allow clients to sign up and cancel on their own and things like that. Likewise, I hate to admit it, I'm a little embarrassed to admit it, I'm kind of back in the Stone Age with my documentation. I still do things by hand. I had grand plans to do electronic records for my clients, but again, just because my practice is so small right now, it didn't seem worth it financially to invest in a secure platform to do electronic records. I also don't want to be typing while I'm talking to clients, but I do like to take notes while they're talking. I'll basically, and I might be getting ahead of myself about documentation. I think I have something about documentation later, but I'll tell you about it now. I like to jot down basic notes about what the client is saying, so that I can just remember it and have it documented for the future. And I always review my notes from last time before the next session, so I can remember what we talked about, what was going on, and goals they had, things to follow up on. And I also jot down things that I want to say. So I really try and be very present when I'm listening. And if there's something that I want to ask or point out to them, I might just make a really quick note and jot that down so that I have it and it's kind of dumped out of my brain, and then I can be fully present and always come back to it if it's important later. I have actually a little template that I use that I just made myself, that I use. So it has the client's name, time and date, any homework or goal check-ins that I wanted to talk to them about. Things we discussed in session is the biggest part. Notes for me to talk about is like another part. And then modalities, so like what did I do, CBT or solution focused or humanistic, like what kind of techniques were used, any new goals or homework to follow up with them about next time, when the next session is, and then payment. So how much they paid and what method, cash, check, etc. I, again, with using telehealth, obviously I can't really do cash or check anymore. So I do PayPal, Zelle, and Venmo. So just ways that people can pay electronically online. Again, if I were to have a more robust practice, I would probably do one of those packages where they could pay online through like my website or something like that. So if you're kind of unbundling, you still need to think about having a reliable internet connection on both sides, yours and theirs, and thinking about privacy. So I, of course, have my own space at my own door that I can thankfully close and make it so that nobody else... Hey, speaking of distractions, I don't know if you heard that. That was my dog shaking. Hang on just a second. You don't want that to happen when you're on a therapy call with a client. So it's perfect to share that I don't let my dogs into the room when I'm in therapy, I make sure that they've been let out, that, I even like sometimes will put a sign on my front door, like, don't ring the doorbell, and either make sure that my partner is out of the house or doing something else where we can have full privacy and limiting those distractions on both sides as well. For example, I have a client who has a roommate, and so advising them like to find a time when their roommate's not around, or different things like that. Another consideration with telehealth is client safety planning. So for example, if you have a client who is having some really serious suicidal ideation that you need to disclose to protect their safety and get them the crisis care that they need, you need to know where they are physically, because if they're not in their office with you, where the heck are they? So I need to always make sure that I have the updated home address of my clients, as well as like emergency contact information. And anytime I notice that they're in a different spot, I say like, hey, are you, where are you? Just so that I can know if there's any kind of emergency where they are physically. So those are some things to think about. Again, that could be telehealth could be an entire lecture. So this is a very brief consideration, but hopefully helpful. So a day in the life of being a therapist. Again, my experience is a little bit different because I haven't been doing it full time, but I have talked with other therapists who say that actually 40 clients a week is not full time. That would be more than full time, because it's not just the hour that you spend with each client, but it's also the time you spend wrapping up documentation, planning and preparing for sessions, doing all your billing and finance stuff, going to the bathroom. These are the things you have to think about. And if you are billing insurance, there might be some expectations about how long a session is. Like, for example, there's an insurance carrier who compensates for a 53-minute session, okay? So if you do a 60-minute session, technically you're giving away 7 minutes for free. 53 minutes seems like a really odd amount of time to have a session. Since I just do low income private pay, I don't do insurance. And so I do 50 minutes, and I let them know up front, it's not like they're expecting an hour and I cut it short. Like, I tell them that, the fee for the session is for 50 minutes. And that gives me time, because I have had them back to back. I think the most I've ever had consistently back to back was 4 in an evening. And even just 4 in a row with a 10-minute break in between them. I mean, time to use the restroom, time to eat, kind of wrap up, prepare, just some things to think about. You should also be thinking about cancellations. What is your cancellation policy? And setting up all of that paperwork, which I actually should have mentioned at the beginning in terms of setting up. You need to have informed consent. You need to have a HIPAA form. You need to have an intake assessment. And so getting all of those documents set up. And one of those things you should think about is your cancellation policy, your non-payment policy, making sure those are aligned with the code of ethics, and building that in both to your schedule and to your budget, because that can certainly happen. So thinking about revenue, we are all in this, I think, to make a difference and help people and have a heart for that, but we also need to survive at the end of the day. And so those business considerations, I actually was a business undergraduate major, and so I've been able to put some of those skills in accounting and all of that a little bit to use as a therapist. You want to think about setting prices that are fair and commensurate with the level of expertise and service that you're bringing. It can really range. So for example, with OpenPath, the lower income, I believe their window is like, you can charge, I think it's $40 to $60 a session, no more. And so that would be, and even that is not affordable to some people, but that is kind of a typical range of like a lower sliding scale option if you can afford to do that. I know people who do private practice whose fees per session are as high as 100, 120 or more. Some people do sliding scale depending on income, and others just work exclusively through insurance. And so it's just the reimbursement rate that insurance gives you. It's been a while since I've talked to folks about doing it. It can really range. Different carriers charge or compensate different amounts. So it might be $80 an hour. It might be less. It might be more. Probably not too much more than that. Obviously, that depends on timing as well. But you can do your homework and some market research about what the fees are in other areas. You need to get paneled with insurance. I don't unfortunately have a lot of experience with this, so I'm not the best resource, but you basically go to each individual insurance, like Blue Cross Blue Shield, and submit paperwork and all this stuff to be able to get paneled, which means that you're kind of listed as a approved provider essentially. And then you would go through like their website to be able to bill the insurance and be compensated for that. You can also do private pay, as I mentioned, which can be more lucrative. Another benefit is that there's less bureaucratic hoops to jump through. Because I'm private pay, there's nobody like breathing down my neck of like, how many sessions have there been? You've reached the max amount of sessions, or having to like share progress or anything like that. But you should certainly be tracking your revenue. There are a lot of tools out there to do this. And I would encourage you to kind of explore and see what is going to work best for you. It could be as simple as having an Excel spreadsheet where you track everything if it's very minimal, to having, more advanced, accounting books or platforms online to track all of your revenue and expenses. So let's move to expenses. So some things that will be expenses include liability insurance, which you are required to get prior to starting practice. You need to have liability insurance. And any business, like if you have an LLC, there's taxes and like annual fees regarding that. You might be renting office space and having overhead as well. So it might not just be the rent. It might not be inclusive of electricity or other services like that. Office supplies and equipment as well. So like your laptop, Kleenexes, hand sanitizer, paper. If you're printing, I unfortunately have to print a fair amount for my documentation notes, as well as like worksheets or things that I would give to clients when I was in person with them, or those initial like intake paperwork, forms that they have to sign, that kind of thing. If you pay to go to CEUs, conferences to keep your license current. If you're having your own business, that means that you don't have the same benefits. So having to also factor in how much is it going to cost me to buy my own health insurance, contribute to 401k or other type of retirement savings, and then taxes, of course, as well. So again, my disclaimer here, I'm not by any means a tax specialist. I encourage you to talk with an accountant about what is required, but essentially you are responsible for paying your own taxes if you're self-employed. It's not just automatically deducted out of your paycheck the way it is, when you're working somewhere and they take out Social Security and all of that. And so there's certain like brackets essentially and income thresholds. And if you're above a certain pretty low level, you have to pay quarterly taxes. So that means you basically estimate every quarter. So in March, for January, February, March, you look at your income and basically kind of prepay your taxes for the year based on what you think you're going to owe. And then either get a refund or have to pay extra in addition to that. You might have someone do your taxes for you. That might be kind of separate from your own personal taxes, but thinking about that, your take-home money, you need to also factor in that you're going to pay taxes out of that, and it can be a fairly significant amount. So definitely recommend visiting the IRS website, looking at the different requirements depending on what type of business you have, and staying on top of that. But you can basically deduct your expenses from your taxes. So say you make $5,000, but you spend $3,000, then your taxable revenue would be $2,000. And so that's why it's really helpful to be able to deduct certain things. And you can actually deduct more than you would expect. So for example, because I have a home office, I actually deduct a small fraction of like my mortgage payment and uh, like Wi-Fi expenses and like that kind of stuff. Or if I go to a conference to get CEUs or to get additional training related to my therapy, I can expense my like airfare and hotel up to a certain level, meals up to a certain level, um, mileage in your car, you know, to visit clients, that kind of thing. So definitely look into that as well, because that'll help control your taxes a little bit. So some of the things to think about are there's actually a lot of ethical considerations. I had actually more on this list in terms of things like thinking about documentation, like how long you have documentation, and like again, kind of like informed consent and all that kind of stuff. But there's a few things that I just want to mention here. So one is poaching. If you work for an agency, it's unethical to basically like steal all of their clients and say, I'm going to do my own private practice and you all are coming with me. So that's just something to think about if you're considering opening up your own practice. You also want to think about the scope of practice and making sure that you are operating within your level of expertise and training, and also geography. So I'm a licensed social worker in Texas, which means that I can have clients in Texas. But I shouldn't be, you know, recruiting clients from Alaska because I'm not licensed in Alaska. And so, especially if you're doing telehealth, that's a consideration as well. Of, you know, your clients need to be in the places where you're licensed to practice. Thinking about confidentiality. So when you are, you know, working by yourself, if you need supervision, that should be one of the things that you kind of mention to clients of a reason to break confidentiality, in addition to, you know, child and elder abuse, serious threat to harm self or others, also receiving supervision from, you know, someone that you would basically pay for outside supervision as consultation, but having it be a little bit more isolating. You can't just like tell your best friend about your clients. And so thinking about that. Termination. So can you fire clients? You know, these types of things that you might be able to lean on colleagues and supervisors for support with, you have to navigate more independently in your own private practice. And so being, for example, a member of NASW can be really helpful because they do free ethics consultations, and but you can certainly refer to the code of ethics, and essentially, you know, being always rule of thumb, sticking with what's best for the client, and that if you're not able to serve them effectively, you can, but you don't abandon, you know, clients. And with that in mind, thinking about contingency planning. If something happened to you, you know, if you had an extended illness or death, what would happen to your clients? How would that be handled? So just kind of thinking about some of those things in terms of your responsibility to clients long term, and boundaries as well. So avoiding like Googling or, you know, looking up your clients on social media, different things like this. A lot of these are relevant for regular therapeutic practice, regardless of if it's your own business or not. But just some things to think about that you'd want to be somewhat confident in, and being able to navigate some of those issues that you'd probably get with experience prior to opening your private practice. And finally, community and self-care. So is a lot of wonderful things in terms of the autonomy and flexibility that you can get by having your own practice, but it can also be isolating. And so I've known people, actually, I received therapy myself from a psychologist once, and he had a like basically support group of other mental health professionals that would meet for lunch every Friday, and not give identifying details, I don't think, of their cases. I hope not, but just kind of talk through, you know, what they were experiencing and getting that advice and support from each other. And so having that could be really helpful. And just filling your tank. If you've had classes or seen other videos from me, you probably have heard me say about putting your own oxygen mask on first before helping other passengers, as they say on airplanes. I think that's true in social work in general, and certainly with being a therapist, because you want to come from a place of healing and wholeness to be able to effectively serve your clients and be there for them and be consistent, regardless of what's happening in your own life, and be able to be that secure, consistent, warm, affirming, competent base for them. And so avoiding burnout and compassion fatigue by practicing good self-care, whatever that means for you, and making sure that there's that balance in your life, and that you're able to be your best self and be there for your clients. So I hope that that was a helpful overview and not too much detail. I think I could have gone on even further with several other considerations and things to keep in mind. But hopefully this at least gets the wheels turning about some things you should think about if you are considering this journey for yourself. And I wish you the best of luck, and go out there and make a difference.